Hey everybody, and welcome to the Dr. Mom Show. It is Dr. D, mom of three, your host. I'm so excited that you're joining us today again. If you've missed any of the past episodes of the Dr. Mom Show, make sure you check them out because you don't want to miss the expert advice and just the life stories and nuggets that you get from the Dr. Mom Show. And of course, this season 3 of the Dr. Mom Show, we again are focusing just on women's health, how we can be better moms, how we can be better women, how we can just take our lives and our legacy to the next level. So don't forget to check those out. And before we get into our show today, don't forget the Dr. Mom Show is a medical informational resource. It does not take the place of your physician or your child's physician. So please make sure that you connect with your doctor for any diagnoses, treatment plans, or any further workup. And before we get into the show today, again, I just want to give a special shout out to Alea Publishing for sponsoring this segment of the show. If you want to turn your vision into legacy and make an impact and tell your story, definitely check out Alea Publishing, LLC.com to write your story. Well, as you all know, I'm always super excited about my guests. So of course, today I am super duper excited to have met this guest. She is in my local area, which makes it even more fun to interview her and to get to know her a little better. And of course, for her to share her expertise with you today. I'm so happy that we are talking about the truth about your pelvis and prolapse. And we have an expert here to talk about that, Brooke Kalisiak. Woo!
Thank you for having me. I'm super excited to be here, so appreciate it.
Yes, same here. So let me tell you a little bit about Brooke. She has done so much. So Dr. Brooke Kalisiak, she is a board-certified women's health physical therapist. She opened Legacy Physical Therapy in January of 2009 in St. Louis, whoop, whoop, St. Louis, baby, to offer specialized pelvic rehabilitation service to the public. She has a passion for also helping not only women, but men enjoy healthy, active lifestyles, restoring dignity and confidence in bladder, bowel, pelvic, and sexual function without relying on pain medications or surgery. Her mission is to educate the public about the importance of pelvic health, which this is why we're talking to you today. Brooke is a graduate of Princeton University, where she was a member of their Division I women's basketball team. Woo, woo. Look at her. She, you know what I'm saying here? Well-rounded. She completed her master's then in health science and physical therapy, and then her doctorate in physical therapy at WashU in St. Louis. She has published professional literature related to pregnancy and exercise, which we all need. And she continues to help other professionals in the field of pelvic health by lab assisting for continuing education courses and teaching at WashU. Help me welcome again, Brooke Kalisiak. Woo!
Thank you for having me. I'm super excited because anytime I get to talk pelvic health with people, I really love it. So thank you for having me on the show.
Oh, you're so welcome. And thank you again, Brooke, for coming on. So Brooke, of course, here we want to give that medical information, but we also want to empower everybody. So I just want you to briefly to share with the audience how you ended up getting into this field and going out on your own.
No, happy to. And I've been a physical therapist for 19 years now. It doesn't feel like that long, but I always knew I wanted to start my own practice. And I fell in love with women's health physical therapy and pelvic physical therapy. And so wanted to create a place where women and men could come and really get treatment for pelvic health conditions. Because at the time that I opened up my practice, there was really quite a hole in the St. Louis market as far as anywhere that specialized in pelvic health rehabilitation. There have been, and there still are, wonderful pelvic health therapists in the St. Louis area, but they're all kind of tucked inside bigger medical systems. And I wanted to create a place where I could kind of shout from the rooftops, like, hey, these pelvic issues they're common, but they're not normal, and there's something you can do about it. And so that's why I created my own practice to kind of be able to get out there and talk to the community more. And we've been around since beginning of 2009 and been growing. It's myself and 3 other pelvic physical therapists here now, as well as a prenatal and postpartum fitness specialist and my wonderful front office staff. And we just love helping people reclaim their pelvic health and get over bladder issues, bowel issues, pelvic pain issues, and pelvic prolapse issues. So I'm super excited to help get the word out there more that there are things people can do to help with pelvic conditions, because way too often women and or men, mostly women though, get told that it's just a common part of aging. Like, oh, you had kids. Oh, you're getting older. Like that leaking's normal. That pain's normal. That, you know, come back when it's bad enough and we'll do surgery, or maybe try these meds and see if it works. But really, that's just a normal part of aging. And it's like, it's common, but it's not normal, people. And there's stuff we can do about it. So that's why I love when I get the opportunity to talk a little bit more about it so people can learn.
That's great. I really like that, because you're right. You know, it's such a myth that as you get older, and like you said, especially as women, I think people get pushed to the side, or they, you know, I think it's something that's also slightly embarrassing for people to bring up, especially when you have younger moms who maybe started to have kids at a younger age, who may experience pelvic issues or urinary issues at a, you know, earlier age. Cause you know, you're kind of like, what? I'm only 30 something or 40 something. Yep. Even 50s, you know, you think that, hey, you know, if you're 60 or 70, yeah, stuff's going to come out. You don't know what's happening. But I love that you mentioned that, you know, it really doesn't matter what you've been through and what age you are, that you should be seeking some sort of help. And it definitely doesn't necessarily have to be invasive. So I do like that a lot.
Very true.
Well, we're going to jump right into it, and we're going to start talking about the pelvic floor. So just so you guys know, you know, Brooke, she's going to really get into this, and I love it. But when we talk about your pelvis itself, literally it's your groin area. So it's below your abdomen. The front part, if you look and you see your buttocks, is the front part where your buttocks is. And you can feel your hip bone, those bony sides by your hip. That's part of the pelvis. And just to kind of, you know, get you acquainted with where we're talking about. And part of that, Brooke is going to talk about the pelvic floor. That's exactly what she's going to get into, so you can know what parts she's talking about and what all makes up the pelvic floor.
Yes. And I always come with visuals, because the pelvic floor area is a little bit hard to visualize, and that. So I brought my trusty pelvis here. So
there's your pelvis.
There's our pelvis. And so right now with us sitting here, we're sitting, and our pelvis is basically kind of sitting just like this. And that, so we've got the 2 kind of bony wings here. And then in the back, our spine kind of comes all the way up from here. This big triangle is called our sacrum. And at the very bottom of it is our tailbone. And that's so, and then when I flip it back forward, if I look and flip it up, and what I call with my patients, they're like, we're going to look at the gynecologist view right now. And that, so here is our pelvic floor region. So anything that's in this reddish pink color is muscle that's in the area. And these muscles go around our urethra up front, our vagina in the middle, and our anus in the back. And they go from the pubic bone in the very front to the tailbone in the very back. And they span across our sit bones. So right now, that bony part of your butt, if you're sitting down watching this, your pelvic floor goes right in between that and goes from front to back. And it basically makes a bowl on the bottom of our pelvis. And this bowl is really important, because this bowl helps to hold up our pelvic organs. So think of it as the bowl, and the pelvic organs are our bladder, our uterus, and our rectum. Those are the fruit in the bowl, and we do not want the fruit falling out of the bowl. So
you can't lose your fruit.
We want to make sure that we have a solid bowl so we don't lose the fruit. So that's one of the main functions that our pelvic floor muscles do. They also help to keep us dry and keep us continent. So when we're learning to potty train as a little kid, we are learning to use our pelvic floor muscles so that we don't pee and poop on ourselves. And so our pelvic floor is really important to make sure that we're not leaking pee or we're not leaking poop. All right. They're also involved in sexual function. So we want to make sure these muscles are working really good so that we can have good arousal and good orgasm. and they're part of our core support system. So if we think of the pelvis as the bottom of our core, the pelvic floor is going to be the very bottom. Our abdominal muscles come in the front here. So the abdominals are going to be the front of that canister. Our back and buttocks muscles are going to be the back of that canister. And at the very top, up by our rib cage, is going to be our diaphragm. So all of that makes one big canister that helps, that's technically all together our core. And those guys all have to work well together. So think of it like a soda can. We don't want any one part of our soda can not working well, because other parts are going to have a lot more stress through it. So a lot of times people wrongly think that the core is just about their abs, and it's really about all of the canister around there that works together.
And I think that's so important, because even if you're somebody who exercises, you shouldn't be exercising one part of your body all the time. That's probably one of the worst things to do. You don't want to tone just one part of your body. Even if you're like, oh, I really just want to tone my abs and I'm happy with everything else, you should really distribute your workout well. And with that, your abs would still get toned because you're using other muscles. Just like Brooke's saying, you know, the pelvis, a lot of people forget about the pelvic region and think about their low back and their abs in regards to their core. But as she mentioned, the pelvis offers this foundation. So as we know, a foundation to anything is fundamental and needs to be strong. So that's why it's important that you focus on everything. So now that you have a little better understanding of the pelvic floor, you know, Brooke, tell us what things, obviously it serves a very important purpose. You know, what things can go wrong with the pelvis?
So these are a small group of muscles around the pelvis here, but they play a big role in a lot of different things. So when we have problems with the pelvis and the pelvic floor, this can show up in many different ways. So it can show up as a pain issue. So tailbone pain, vaginal pain, rectal pain, abdominal pain, or back or hip pain. All of those can potentially be caused by a pelvic floor issue. Pain with intercourse is another one that is highly linked to pelvic floor and pelvic issues, whether it be from scar tissue after having a baby or muscles that aren't quite relaxing the way that they should be, that can contribute to pain in the pelvic around the vagina with intercourse, or pain in the vulvar region. We can also see leakage issues, and this leakage can be from the front door or the back door. So we can have bladder leakage issues where sometimes people are leaking with cough, laugh, sneeze. Maybe they leak. A common one we hear from our patients is like, I can't jump anymore. Like my kids want me to go, you know, to the trampoline park and jump on the trampolines. And they're like, nope, that's not going to happen. I'm going to leak when I do that. Or they leak when they run, and they're running is their way to get away and, you know, get a workout in real quick, but they're not able to do it anymore because they don't like the bladder leakage that is occurring with it. So that's another type of leakage. We also see leakage on the side of urgency or frequency, that people can't get to the bathroom in time. They get the urge to go, but they leak before they get there in time, or they're going lots and lots of times throughout the day to try and minimize the chance of leakage. On the bowel side of things, we can have fecal leakage, whether that's in the form of gas or fecal material. So a lot of people have, you know, we all pass gas, that's normal. But if it's happening often and you have no control over it, that's a problem. And there are things that you can do about it. On the flip side of it, pelvic floor issues can contribute to constipation issues. So if you're having trouble having bowel movements, your pelvic floor muscles might not be doing what they're supposed to be doing. And we need to get them to relax and let go, or coordinate together better. And that's, so a pelvic floor issue can contribute to constipation things. And then, like we're going to talk a little bit more about today, prolapse issues. So women are super lucky in that we can have, like I just talked about, the fruit can start to fall out of the bowl. And we can have various types of prolapse issues where our organs are, whether it's our bladder or our rectum or our uterus, can start to fall down into the vaginal canal. So that is something that many women are unaware of, and that can happen to them, and are very surprised when that does happen. So one of the things I like to educate women about is that this is a possibility that can happen to us, and there's things we can do to prevent that, so that we're not caught off guard with this happening potentially when it does.
Yeah. So as you guys can hear, there's tons of things that could go wrong with your pelvis. And I think one of the key points we want you to take home today is if you feel like something's off, you feel that something's happening that wasn't happening before. I feel, especially women, we just have this sixth sense that we're just like, something's not right. Listen, 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 listen. I know the pelvic area isn't something that people like jump up. People don't come to me and say, "Oh, I'm ready for my PAP exam for the year." Like, everybody's always late for that. Nobody's excited to get it. So the same way, I'm sure, Brooke, people usually aren't running to be like, "Hey, I'm leaking."
Correct.
Can't wait to see you. But I think one thing to take home today is if something's wrong, please make sure that you see your physician or get to physical therapy. We all know about physical therapy, and then today you're learning that there's therapists who specifically focus on the pelvic region, so you're able to strengthen, just like we go to a therapist if we have a shoulder pain, a shoulder injury or something like that. Brooke focuses on that pelvic health issue. And again, as she mentioned, today we're specifically going to be focusing on prolapses because, one, there's just a lot of information in the pelvic, and we just want to be fair to you guys so you get the best out of the show and the best from Brooke, her knowledge based off of it. So that's why today we're going to focus on prolapse. So what all different types of prolapse? You mentioned, there's uterine, there's cervical, there's vaginal, just keep it coming.
Yeah. So there are several different types, and that's so, if we go kind of front to back in the pelvis with the organs, our bladder is in the very front. And so that can tip back into the vaginal canal. Then we have the uterus that can I think of that as kind of like a sock turning inside out, that the uterus can kind of start to come down into the vaginal canal. Many women wrongly assume that if they have had a hysterectomy that they're not at risk for prolapse anymore, but they are actually more at risk because gynecological surgeries put us a little bit more at risk for prolapse because it changes the support structures around there. So when we experience prolapse, it's a combination of what supports our organs is a combination of muscular support from below, so that bowl of the pelvic floor muscles, as well as ligamentous and structural support from above. So I think these are kind of like the puppet strings that help to hold up the organs a little bit. And so when we have a surgery, that can kind of mess with that support a little bit. So if people have had a hysterectomy and they don't have a uterus there, they still can have prolapse in the form of the cervix, the top of the vagina, kind of coming down into the canal, or they can have the bladder tipping back into the canal, or the rectum can tip forward into the canal. And oftentimes what people first notice when they're dealing with prolapse is a bulge in the vaginal canal. Like when they go to wipe, they feel a bulge, or they take a mirror and they kind of look down there and they're like, I see a bulge down here. Or people have described it as like, I feel like I'm sitting on a golf ball, and they've got this bulge or this pressure there. And I'm here to tell you is your bladder has not come through the vaginal wall. Your rectum has not come through the vaginal wall. The bulge that you're seeing is actually the stretched out vaginal wall, but the organs are kind of behind that, creating some of that push. So a lot of people get really worried, like, oh my God, is my bladder going to fall onto the floor? That's like, no. Like, this is a stretching out of the vaginal wall, but it can feel like it's your bladder kind of because it's pushing on that wall.
Yeah. So today we're going to focus because we want you to be able to recognize the signs and symptoms, and then of course how you can reach out to people like Brooke, and then what are the options for you. So how are these treated? How are these different prolapses treated?
So really what first happens is if you are experiencing what are potentially prolapse symptoms, you should reach out to one of your medical providers, and most likely it would be either your primary doctor or your OBGYN or gynecologist would be the people who are probably diagnosing this first. But common symptoms are a bulge in the vaginal canal, pelvic heaviness or pelvic pressure, especially as the day goes on. So the longer you're on your feet, the longer you're active, you start to feel the pressure and the heaviness more. You might also have back or pelvic pain that go along with it. You may notice changes in bowel or bladder function. And these changes can be all across the board. I can have people who used to be able to go really easily, and now they have a hesitant stream. It can show up as people didn't have leakage and now they do. It can be the opposite. They did have leakage and now they don't. They have trouble passing a bowel movement. So any change in bowel or bladder function, especially if it's combined with feeling of heaviness or pressure and or a bulge in the vaginal canal, is a sign that you should go talk to one of your medical providers about the symptoms that you're experiencing. The good news is when it's caught early, so there's different stages of prolapse. They're graded from stage 0 to stage 4. When we catch it early in like a stage 1 or 2, research has really shown that conservative treatment options like pelvic physical therapy can be really helpful in reducing the prolapse and reducing the symptoms that you're dealing with. So many people are able to get over the symptoms that they're experiencing by learning how to use their pelvic floor muscles better, by changing their posture and their lifting habits, by changing their bowel habits, and really kind of making sure that we've got good support through the core and the pelvic floor. And so where the reason why I bring up catching it early and trying to do something about it when it's small and the stages are lower, is because oftentimes people unfortunately get told, well, it's not that bad. When it gets bad enough, come back or call me and we'll schedule surgery for it. And so people wait and do nothing. And there's really a lot of changes, things that you can do in those early on phases to avoid having to have something more risky and surgical done later on. And so my advice is, if it doesn't feel right, check in with your provider. And you may have to be the one to ask to get a referral to a pelvic physical therapist, because your doctor may or may not know that that's an option. And their go-to might be that, like, hey, we're going to wait and watch it and see. And if it gets bad enough, then we'll consider a surgical option. And there's many other options along the way that you can do to really avoid having to go down that more risky route of surgery. And so it's important to kind of know about those options, but know that you may have to be the one who's advocating for it for yourself.
Yeah, and that's so important. And you guys have heard me say it before, number one, your relationship with your provider is so important, because just like Brooke said, you want to be comfortable enough to say, hey, is there any other options out there? And for me, I'm always open when patients may say something. I think the only time that I may say, hey, is if, let's say somebody comes and their cervix is hanging out of, the vaginal opening. That's different. I would probably say, I think we're past the whole therapy stage. That's probably surgery. And again, that's why it's important to bring up these concerns sooner than later, because there's other options like therapy, the pelvic floor rehab therapy that you can go through to try and so let me ask you, Brooke, can they completely reverse it, or does it help to just delay the progression of the prolapse?
So if someone's in a stage 1, research has shown that they can kind of reverse it completely and not, be completely asymptomatic with it. And really, a lot of times what contributes to or causes prolapse is prolonged stress and strain on the tissue. So one of the reasons why women are at risk for it is because we can have babies. And so pregnancy puts a lot of stress and strain down through our pelvic floor. The type of delivery that we have can contribute to it. So if we have a vaginal delivery and there's tearing or that occurs, even if there's not tearing, there's a lot of stretching that happens. And sometimes our muscles and tissues don't necessarily recover as well as we would hope from that. And so they're in a weakened state. And then if we combine that with potentially lifelong issues with constipation, we combine that with bad lifting habits and bad posture, that's going to put a lot of stress and strain. So a lot of people do what we call the Valsalva maneuver, where anytime they have to lift, or whether it's themselves out of a chair or whether they're lifting up kiddos or lifting groceries, they kind of end up doing a little breath hold. That's going to put a lot more pressure down. So we do that for potentially years, and that tissue eventually kind of gives way and says, I can't hold up against this strain anymore. And that's when we potentially see the prolapse kind of occurring. So what I talk with a lot of our patients about is even if it is a larger grade of prolapse, and that partnering with a pelvic physical therapist either before and or after surgery can be really helpful, because you still need to change those habits that you got into that got you into that place to begin with. And so see many women who have had a pelvic organ prolapse repair surgery and have done well for 5 to 10 years, but then they end up having prolapse symptoms again 5 to 10 years later. And in almost all of those cases, when I ask them, I was like, did you do any type of rehab either before your surgery or afterwards? They're like, no, I was, everything was repaired. I was feeling great. And it's like, but you never changed any of the habits that happened. Yeah. And so we went right back to Valsalva, or you went right back to constipation and straining to have a bowel movement, and all this stuff again just started beating down on that tissue again. And so really I would love to see it be the standard of care where someone does go and get a prolapse repair surgery and they partner with a pelvic physical therapist afterwards to make sure that they're lifting correctly, using your core muscles correctly, your pelvic floor is working the way that it should be, so that we keep getting better and better surgical outcomes, so that hopefully we don't have people who are having that repeat surgery, and then also maybe being able to prevent some people from having to go down that route altogether.
So speaking of prevention, what can people do to prevent pelvic prolapse, or just keeping, what can we do to keep a healthy pelvis?
Gotcha. And so one is making sure that we can correctly recruit the pelvic floor muscles. So if you're sitting here watching this show right now, or you're listening to it, what I really want you to think about, remember when I talked about when we're sitting, that our pelvic floor goes from the front to the back and spans across the two sit bones here. So you should be able to feel your sit bones on the chair. And if you're correctly recruiting the pelvic floor muscles, you should be able to feel like you kind of squeeze around the vagina and kind of lift that area up off the chair without your butt bones lifting off the chair. So if you feel yourself kind of bouncing out of the chair, you're using your butt muscles, you're not using your pelvic floor. So you should be able to do that. I'm doing it right now, and I'm still talking. So where a lot of people go wrong is that they kind of hold their breath and tense everything. So we want to make sure that we're able to recruit those pelvic floor muscles correctly. And if you want to add to it a little bit when we're talking about the core, can you also gently pull in your tummy muscles at the same time? So can you pull your belly button back away from your pants while you kind of lift up your pelvic floor? And can you talk at the same time? Don't worry, I'm not going to make you like pat your head and rub your belly. But a lot of people have a hard time coordinating those things together. So that's something that we really work on. So that's one tip, is making sure, can we recruit our pelvic floor correctly? If we can't, you should partner up with a pelvic physical therapist. If you're not sure you're feeling it right, they're the ones who can assess that. Another thing that can help you keep a healthy pelvic floor and help you avoid or prevent prolapse is making sure that you're dealing with constipation. So if you are constipated and having to strain to have a bowel movement, we want to figure out why and get that fixed. A simple change in posture on the toilet that works well for a lot of people is getting their knees up higher than their hips. So using a stool to make sure you're in more of a squat position on the toilet. And I get no monetary reimbursement from this company, but the Squatty Potty is an awesome invention. And it helps to get our knees up above our hips and out wide. So I highly recommend. I'm 6'1" and I use a stool to have a bowel movement. So it's not a height thing. For those of you with small children at home, this can work as their stool too, but you just happen to use it as well. But it helps get us in a good position so that we can have a little bit easier bowel movement and not strain. So if you're dealing with constipation, you need to get that under control, because that's a lot of stress and strain down through the pelvic floor. And the third tip that I would give as far as trying to prevent is making sure that you have good form when you're lifting. So that little belly and pelvic floor pull-in that I just talked about, trying to engage that first. And anytime you're going to lift something heavier, you want to think about exhaling or blow before. So I call it blow before you go, or exhale with exertion. So if I'm going to lift up something heavier, I'm going to exhale as I do that. That lets me let pressure out my mouth instead of pressure down through my pelvic floor area. So that's a good way to make sure that you've got some better lifting form with it. So those are 3 kind of simple changes that anyone can kind of take a look at and see what they're doing to see if they can make a difference to help take some of the pressure off of their pelvic floor area.
Thanks, Brooke. I think all those were so great. And, ultimately just to bring those together, essentially, it just seems like having good control of your pelvic muscle. So the better control you have, because obviously if you're constipated, you don't have control of your pelvic muscles. If you're not lifting well or properly. And as we all know, people usually think of hurting their back if you're not lifting properly. But look, you're also hurting, again, that foundation that Brooke talked about that is helping hold that fruit together. You're also holding that fundamental area. Well, awesome. Well, Brooke, this has been great. Do you have any final words, any final tips about pelvic health before we finish up?
Honestly, I've said it already in the show, but my main thing is a lot of these pelvic health conditions like prolapse, like bladder leakage, bowel issues, even pelvic pain, they are common issues. They're more common than but they're not normal. And so don't let any healthcare provider tell you that this is just a normal part of aging, or this is normal because you had a baby, and that your body better than anyone else. And if you're feeling like something's off, like Dr. D said, talk to your healthcare provider and, see what's going on. But you, especially when it comes to pelvic physical therapy, you may have to be the one who advocates for yourself that you want to try this route out. Don't be scared. Just kind of speak up and say, hey, I'm experiencing this and I want to see, I heard about pelvic physical therapy and that's something that I think I'd like to try, because you may have to be the one to advocate for yourself about it.
Yeah, and that's great. And of course, advocating earlier is always better. And before we finish up, of course, it's time for our empowerment challenge. And Brooke is just an amazing example of, her just taking the bulls by the horns and, doing her own thing. I love how she said she wanted to just be able to get at the top of a building to, to scream her message. And I just really love that passion. And I know a lot of you listening or watching, you're passionate about something. And sometimes you just got to take that step of faith and, do what you really want to do. And, Brooke has been successful in what she's done. And I'm so glad that her practice has grown so she and her colleagues can get out there, help people get the message out there. And that's why there's shows like the Dr. Mom Show to help her get her message out there. Yeah. So again, the empowerment challenge, Brooke, I'm going to give you 3 topics. You will pick one and then just drop some nuggets on our audience about whichever topic you pick. So your choices are reclaiming your identity, mastering parenthood, and re-identifying your God-given intuition.
Okay, so I think I'll go with reclaiming your identity, and I'll talk about it in terms of your pelvic identity. So don't let people tell you that bladder leakage is a normal part of being a woman or aging. All the Poise commercials out there right now are talking about, just put on our lovely newest line of sleek Poise underwear to catch those leaks while you work out. Leaking while we work out is not normal. It is a sign that something's going on. And so if you are having bladder leakage with running, with lifting, with any type of workout, or it's preventing you from working out the way that you want to, there are things that you can do about it. So I'm advocating for you to reclaim your pelvic health and know that there are things you can do to make a difference with it. And it's not something that you just have to deal with as you get older. You can make a change and so I'm advocating for you to be active in reclaiming your pelvic health and make a change to what you're experiencing so that you're not just getting, more and more bladder symptoms or pelvic symptoms as you age. A common thing that I say for a lot of my people is we are not all marching back down the path to diapers. So let's be done with diapers at an early age and make sure that there's things we can do to prevent ourselves from having to go back that direction.
That's so great. I love that. And, of course, if you aren't in the St. Louis area, it's okay if you check out Brooke's website, legacytherapystl.com. She has a lot of pelvic health information on there, so you can at least get some information, at least just, educate yourself a little bit, that if you're not in this area, you're able to speak with your provider about potentially getting checked out, or this option if you have any symptoms that we discussed today. So again, Brooke, thank you so much. And of course, other than your website, if the audience wants to connect with you, how can they do that?
So we try to get information out there on many different channels. So our website has all of the links with it, but we're on Facebook at Legacy Physical Therapy STL. We're on Instagram at Legacy Physical Therapy, and we put out videos often on our YouTube channel talking about different options. And there is, if you are not local to St. Louis and you're looking for a pelvic physical therapist, our national organization is the Academy of Pelvic Health. And they do have a find a PT option on there. So you can put in your zip code and look and see who may be local to you. So if that's an option you're wanting to look into, you can figure out who may be close by in your direction. So.
Awesome. Well, thank you again, Brooke, for joining us today. It's been a pleasure, and you've taught us so much.
Wonderful. Thank you for having me. It was so much fun to be able to talk pelvic health with you. So I appreciate it.
And then, of course, thank you to all our viewers and our listeners. Don't forget to share the podcast or the video, because, I feel there is a large population of people who struggle with a pelvic health issue. So make sure you get the education out there. Don't forget to subscribe, of course, to the Dr. Mom Show on YouTube. And you can check us out on Facebook at the Dr. Mom Show, or on Instagram at drmom_show. And then, of course, if you like Facebook, you can always join the Dr. Mom Show group called Fulfill Females, where we just challenge each other, do tons of fun things on there. And really is just a support group to help each other. And then finally, make sure you get your copy or pre-order your copy of Dr. Mom's Ultimate Guide today. I'm so ecstatic about this book that's coming out. It's been like a work in progress for so long, something that I've loved to do, just to share with moms ways to love life, to love your family, to love work, to just enjoy life, because we just live once. And I feel as moms, we end up getting bogged down by so many things that can go in the wrong direction pretty rapidly. So make sure, if you have somebody, a mom, a aunt, a grandma, whoever it is, get them a copy. And if you're a mom, it's okay to treat yourself. All right. And then, of course, make sure to check me out on drdalenemushalak.com. There's some freebies on there if you want some resources about a whole bunch of different health things, and just stay up to date with everything that's going on. And make sure you listen to my TEDx talk. Again, so excited. May 1st, I got a chance, an opportunity to do a TEDx, my first one, not the last one. So make sure you check that out on the TED platform. And of course, you guys know that you are all superheroes. Have faith over fear. And as Dr. Mom always says, don't forget to wash your hands, kiss your kids, love your families, and say your prayers. Good night. Love you guys. Take care. Make sure you lift well. Bye.
Bye.